Hey guys, it's been a few days since the last time we had a message on COVID-19, but so much has happened. The World Health Organization has indeed named this a pandemic, which means not that it has increased in severity, but it has increased from transmission locally to global transmission of this disease that we've never had before. So it's important for us to recognize that because there is no vaccine and because we don't have immunity, all of these preparedness efforts are to slow down transmission, to make sure the capacity of our acute healthcare facilities can keep up with screening, sample collection, and treatment of the anticipated 20% of people who will require hospitalization. The remaining 80% will be able to recover from their symptoms at home. We have to make sure that we understand that the efforts that we are taking are in response to slowing the transmission rate. Earlier this week, Governor Lamont declared a public health and civil preparedness emergency, as have governors in the neighboring states. Also, too, have I reached out to my counterparts in jurisdictions around New England to specifically talk about strategies related to child welfare and child protective service delivery. It is recommended that you refrain from large gatherings of over 100 people who are in close proximity to each other. And further, the governor's latest executive order prohibits Connecticut to have events that are over 250 people until further notice. All of these provisions are, again, to slow the disease transmission so we will have the ability to have our healthcare industry respond properly. We do not have the ability to stop it altogether, so all of these efforts are what we can do to try to make sure that our healthcare facilities have what they need to treat the 20% of people who will require their attention. We here at DCF are in the business of keeping children safe. It's what we do well. At the same time, it's my job to make sure that you're okay and that your families are safe. As we work towards our key results, we are challenged by the ability to do our jobs in the way that we would ordinarily do it. With the children and families that we are charged to serve, we now have additional constraints and barriers that may make it a little bit different in the way we do our business. It is my job to make sure that we are as committed to the safety of our mission and to the execution of our mission, but equally committed to make sure that our workforce is protected at all times. We continue to monitor the evolution of this pandemic in our country and in our state, and we realize that we need to make major adjustments to our child protective practice as a result. Particularly those of you who provide direct care and have contact with children and families within communities, we need to ensure children's safety as we simultaneously make provisions to ensure your safety. So in order to keep children safe, we are not able to suspend home visits altogether. What we are asking for is increased vigilance in planning those visits and to think about safety factors as you would in preparing to make community-related visits, such as the way that we assess the potential for violence in particular homes or communities that we serve. There's a lot of information being shared with you out there. We want to make sure that not only is the information credible, but it's accurate and timely. We also want to make sure that we don't oversaturate you with so much information you don't know what to prioritize. You will be getting memos related to home visits, how to screen for safety in terms of health-related issues. You will also be getting some HR documentation on frequently asked questions that have been sent out statewide to other state employees related to COVID-19 and the impact it will have on the way we do our work. You will be sent links to the memos that we sent to foster parents, as well as what we sent to contracted providers. We will also have a mailbox set up to be able to hear your questions and the questions that you may have related to DCF's response to this pandemic. Please read all of these documents as they contain important information and guidelines that we all need to make adjustments to the way we do our work. One of the memos that you will be receiving has to do with the Everbridge notification system. I just want to use this opportunity to reiterate that if you have not registered for Everbridge, there's a link within that particular memo to make sure that you can, or we actually highly recommend that you sign up for these notifications. That is a way that we can reach all of you at one time with information as it becomes available. The recommendations related to social distancing, regular hand washing, and disinfecting continue to remain the primary importance of how we will slow the pace of transmission. These simple steps, along with coughing and sneezing into your elbow and staying home if you feel sick, will contribute greatly to the reduction of the pace of the transmission. Many school districts have also closed, which adds to the considerations that we must adjust for working parents, as many of you are. We will need to make alternative child care arrangements while schools are closed and not in session, and some families that we serve will even be impacted by food insecurity. This means that some districts have had to plan to mitigate this food insecurity by having breakfast and lunch items available for children to pick up in their local areas. So as planning continues, understand that we have to do this simultaneously to how you plan for your family's child care needs as well as the child care needs of the children and families that we serve. These are extraordinary times calling for extraordinary measures to keep children safe and to keep you safe. Please continue to look for information, and we will continue to share such information in an accurate and timely way. We will continue to meet with our statewide partners in order to make sure preparedness takes into consideration the work that we do specifically in our area offices and our facilities and our central office divisions. I really appreciate your continued patience. The planning for this pandemic changes literally every hour. Sometimes information will feel like will be coming at rapid fire, and other times it'll feel like you don't have enough information. Please know I appreciate your patience. This is unprecedented. We are making decisions sometimes at a moment's notice. Recognize that I have the department's well-being and your well-being in the forefront of every discussion that I have. We are truly in all of this uncertainty together. Please stay tuned, and I appreciate your cooperation until our next message. Thanks.